Hi, and welcome to Journey to Recovery. Today we're going to talk about understanding diagnosis. Now, when you go to a mental health professional or sometimes even your physician and you're talking with them about depression or anxiety or something else that's kind of mental health related, it's important to understand kind of what they're talking about when they're diagnosing you. Diagnosis is part art and part science. The science is the fact that we know that certain brain chemical changes and certain changes within hormones and all those other physical things can lead to certain behaviors or symptoms that we call depression, anxiety, bipolar, schizophrenia, yada yada. That's the science part. The art part is figuring out which one fits. When you start looking at the different diagnoses, there are a lot of symptoms that overlap. For example, difficulty concentrating, changes in appetite, fatigue. That could mean a whole host of different physical or mental health sort of things. So we need to differentiate what's causing the different symptoms for each person. Diagnosis starts out with a whole bunch of generic things. Like I said, fatigue, difficulty concentrating, and really not finding anything enjoyable. We all have those days. Does that mean we're all depressed? No. What it means is that we are all having natural reactions to something. Maybe you didn't sleep well. Maybe you are fighting off a cold. There are a variety of different things. When we talk about diagnosis, we talk about something called clinically significant distress. What does that mean? Basically, when you're having symptoms and you're having them over a long period of time, a week, 2 weeks, a month or more, and they are causing problems in your day-to-day functioning, your quality of life, the way you participate at work, your relationships, any of those things. These symptoms are causing problems over a long period of time. That's what we call clinically significant distress. It means it's bad enough for you to make an appointment and go to the doctor. The other challenging thing that people need to remember is that not everybody fits neatly into one particular diagnosis or one particular category. That doesn't mean that there's nothing wrong. What it means is you don't fit neatly into anything. Or maybe you have depression and anxiety. Bonus. Talking with your physician about what causes your symptoms, what makes them worse. If you can remember a time back before you started having symptoms, what was different? What's changed that has started prompting those symptoms? Change in your sleeping habits, eating habits, work, family situation, relationships. There's a whole list of things that can cause temporary or even long-term depression or anxiety. So that's the first part. The second part is to remember that diagnosis, when we say someone is depressed, it's shorthand. It's like saying somebody has the flu. Not everybody who has the flu is going to be vomiting and running a super high fever. They may, but not necessarily. Not everybody who's depressed is going to have thoughts of suicide or is going to have difficulty getting to sleep. Some people sleep too much. The shorthand just enables us to talk about a cluster of symptoms among each other, so it's easier to communicate about what's going on. I don't want you to take these diagnoses and say, well, if I'm depressed, I'm always depressed. It shouldn't be a self-fulfilling prophecy, because you wouldn't say, well, I've got the flu, so I'm always going to have the flu. You can recover. You help your body figure out how to deal with it. You help your mind how to figure out how to deal with it. If you go in and you're talking to your physician, feel free to ask to see what we call, it's the DSM-4. Well, actually, it's the DSM-5 now, but a lot of people don't have that one yet because it just came out. Anyway, I digress. Ask them to see what they're basing the diagnosis off of. When I bring a patient in and we do an assessment and I'm making a diagnosis, I get the book out and we look at it together and we go down the list of symptoms. There's usually, 6, 8, 10 symptoms, and you only have to have 4 or 5 maybe to qualify for the diagnosis. Why is that important? Pretty much the only reason that's important is for insurance. So, if you don't fit neatly into any one diagnostic category, remember that doesn't minimize your situation. You want to focus on what the symptoms are and how to fix them. You want to talk with your doctor also about the symptoms you don't have, because that may give him or her clues to whether you're suffering with issues related to depression, anxiety, bipolar disorder, or a variety of other things that are going on. Before you go into your doctor, the other thing to know about diagnosis is that, you know what? You're the expert on yourself. Get online, Google it. If you think you're depressed, Google symptoms of depression. If you think you've got anxiety, Google symptoms of anxiety. A lot of times you'll come up with a very quick self-test to help you figure out what is kind of going on and where you might want to start talking with your doctor about your symptoms. Bring that with you. That gives you a starting point to talk about. That gives you the ability to advocate for yourself in order to get the care that you need. Thank you for joining us today, and please tune in for further installments on Journey to Recovery. Bye.